In India, it is estimated that more than 180,000 women suffer from cancers originating from female pelvic organs, accounting for about 30% of all cancers in women. In the United Kingdom, each day approximately 58 women receive news of a new diagnosis of gynecological cancer, and 21 lives are lost daily. Namaskar, hello, thank you for joining me. My name is Pritha. I'm a gynaecologist from India, now working in London, and today I'm going to talk about the common gynecological cancers and, more importantly, ways to prevent them. First, let's have a quick look at the female organs. On both sides are the ovaries, the organs producing eggs and the bulk of female hormones, estrogen and progesterone. Centrally, we have the main body of the womb called the uterus, flanked on both sides by tubular structures called fallopian tubes, and below is the neck of the womb called the cervix. The cervix opens into the vagina, which ends at the exterior surface called vulva, which is part of the skin. Gynecological cancers commonly originate from the cervix, the body of the womb, and the ovaries, sometimes from vulva, and very rarely from fallopian tubes and vagina. In this video, I'll cover the four main organs where cancers arise, namely womb, cervix, ovaries, and vulva. First, let's talk about womb cancers. They usually originate from the lining of the womb, and medically we call them endometrial cancer or adenocarcinoma of the uterus. There is another variety that can seldom happen that comes from the muscle wall of the womb. And I should mention here that fibroids, a common growth of the womb wall muscles, are non-cancerous and only very rarely can progress to cancer, less than 1 in 1,000. About 75% of women who have womb cancer are in the postmenopausal age group, and risks include any situation where the lining of the womb gets the opportunity to proliferate unchecked. For example, with polycystic ovarian syndrome, where periods are repeatedly delayed for more than 4 successive months, when estrogen is given as part of hormone replacement therapy without adding progesterone in women with an intact womb, in women on the breast cancer treatment medicine tamoxifen, and also obese women as fat cells are known to store excess estrogen. Like many other forms of cancer, genetics also has a role to play here. The most important symptom to look out for is abnormal vaginal bleeding in the perimenopausal period and postmenopausal bleeding or discharge. If you are unsure of what perimenopausal and postmenopausal means, please watch my video on menopause. The link is right up here. Now, having vaginal bleeding after menopause does not necessarily mean having cancer, and thankfully 90% of postmenopausal bleeding will not be because of cancer. But these should be checked out 100% of times by visiting your GP, and postmenopausal bleeding is in fact an indication for urgent referral to gynecologist. At the clinic, you'll have a clinical examination, and in addition, an ultrasound scan will be advised, sometimes even a biopsy or a small surgery called hysteroscopy. At the moment, there is no screening test for womb cancer, but for prevention, we need to maintain a healthy lifestyle, make sure we have periods at least once in 4 months, and seek appropriate medical advice before starting hormone replacement therapy. Number 2, let's talk about cancer of the neck of the womb or cancer of the cervix. This is one of the leading causes of female mortality, especially in developing countries, and is usually seen in the younger age group, those between 30 to 45 years, though there is another spike later on in life. The common form of cervical cancer is technically medically called squamous cell carcinoma of the cervix, and nearly all of these result from a sexually transmitted infection with a virus called human papillomavirus. There are about 100 types of this virus, but the high-risk ones, the culprits, are mainly type 16 and 18. These are spread by sexual contact, which can even occur without penetrative intercourse. And about 80% of global population come in contact with it at some point in their lives, but in most cases it clears up without any concern. Unfortunately, sometimes it causes abnormal growth of the cells, resulting in cancer. Additional risk factors are smoking, having other sexually transmitted infections, being on immunosuppressive medicines, being on long-term contraceptive pills, and even past childbirth, especially having first child when aged under 17. The symptoms are abnormal bleeding from the vagina or abnormal discharge, bleeding or pain after sex, and pain in lower back, lower tummy, or pelvis. So if you have any of these symptoms, you should consult your doctor. You might need an ultrasound scan, a camera test called colposcopy, a camera to look at the neck of the womb with a magnified view, and occasionally even a biopsy. Now, because of the vagueness of the presenting symptoms, diagnosis can be late, but there is a very big good news, as unlike all other forms of gynecological cancer, prevention of cervical cancer can be easily done. A, by offering young girls vaccination against human papillomavirus. In the UK, 12 to 13-year-olds are offered HPV vaccination. As depending on sexual habit, HPV can also cause cancers in mouth, throat, anus, and penis. Young people of all genders are advised to get vaccinated. B, very important, by undergoing regular cervical screening. I cannot stress this enough, and in fact, I need to do a full video on this. This is really the best way to protect yourself from cervical cancer, and it only involves a basic test that is done once every few years. It pretty much involves collecting some cells from the neck of the womb by scraping and testing them under a microscope. This is popularly called smear test. You might have heard the name. And other investigations are done only if required. The UK has a robust national cervical screening program where all women aged 25 to 49 years are invited to have the test done at least once every 3 years. And for the next 15 years, up to the age of 64, it is done every 5 years. This has helped save thousands of lives in this country and is one of the biggest success stories of the NHS. Similar arrangements exist in other developed countries too, and even in India, some local health agencies and cancer specialist hospitals are making earnest attempts at introducing similar measures. You know what India lacks in health infrastructure? It makes up with cleverness and ingenuity of its healthcare staff, and I know lots of research are going into this as I speak. If you are not part of any cervical screening program, for whatever reason, I urge you to make an appointment with your gynecologist and privately arrange regular smears for yourself if you're not part of NHS or a similar health service provider. And please pass on this message to all women you know. The other preventive measure is, of course, it goes without saying, always practice safe sex. The third cancer I'll discuss today is cancer of the ovary, which can arise from any part of the ovary and may happen at any age, though 80% of them are seen in women who are more than 50 years old. The biggest risk is having a kind of genetic variation. You may have heard of BRCA gene. It was the talk of the town a few years ago when Angelina Jolie announced that she was getting her breasts and ovaries removed as she is genetically at high risk of developing cancer of these organs. Now, women having first-degree relatives with cancers of ovary, breast, bowel, possibly even pancreas and prostate are thought to be more at risk. There is some conflicting evidence on the association between HRT and ovarian cancer. On the other hand, contraceptive pills are thought to have a protective effect like pregnancy and childbirth. Other risks are obesity, smoking, and rarely exposure to asbestos or even talcum powder used in the nether regions. There is a small chance that it may be associated with cancer of fallopian tube or ovary. Symptoms of ovarian cancer can be difficult to understand. Bloating, indigestion, early satiety, tummy discomfort, change in bowel habits, or unintentional weight loss in the postmenopausal age, they all necessitate a visit to the doctor. You may be asked to get an ultrasound scan done, possibly also with a blood test. Sometimes CT scan or MRI scan could be arranged. Unfortunately, there is no reliable screening method for ovarian cancer, and as symptoms are vague, diagnosis is often made too late. Thankfully, the ultrasound scan is an excellent tool to look at pelvic organs. So if you have any concern, seek medical help sooner rather than later. This applies especially for women of advancing age and those with positive family history. In fact, if you have a very strong family history of cancers of the organs I mentioned, I suggest you consult a clinical geneticist to discuss your individual risk and possible preventative measures, even if you do not have any symptom. In the UK, you have to go to your GP first and then they'll refer. Number 4, the last cancer I'll discuss is cancer of the vulva, which is also primarily seen in the elderly, and HPV and smoking are again the risk factors. Skin conditions that cause inflammation like vulval intraepithelial neoplasia, VIN, and lichen sclerosis are the other culprits. They can present as vulval itch, soreness, pain, change in texture, color, a new mole, lump, or growth. If suspected, a biopsy can be done under local anesthetic in your doctor's clinic. There is currently no preventative measure. The women with lichen sclerosis are advised to attend annual medical checkups. Now, all is not doom and gloom, as most women with any of these symptoms or a combination of these will not have cancer, even if they belong to the older age group. But we do not wish to miss the ones who do. The earlier the diagnosis of cancer is made, the better is the prognosis, the less is the chance of spread, as we all know. And a lot of these cancers are genetically inherited. So whilst we cannot fight our genes, we can make some constructive adjustments to our lifestyles, like maintaining a healthy weight, practicing safe sex, avoiding smoking, and compulsorily get routine smear tests done. Of course, for any concern, please do consult your doctor. Links to useful resources on public awareness and information on gynecological cancers are in the video description below. Now, this is my 4th consecutive video on women's health. All of March, the month of International Women's Day, I have spoken on topics like menstrual products, contraception, menopause, and now this. I do promise to give you a break from this heavy-duty gyan for the time being, and if all goes according to plan, there will be a skincare review and a dance video coming up next week, so stay tuned. If you found this useful, please show me some love and encouragement by hitting the subscribe button. I promise you it is free of cost. Stay safe, stay healthy, and get your smear test done. Bye.